My name is Tim Murphy and I lead the advocacy and research program for the Leukemia Foundation. As you all know, the Leukemia Foundation has been working hard over the years to not only support people living with blood cancer in their moments of immediate need, but also to think about how we can make improvements to our health system and improve care. So that is the work that I lead for the foundation. And the things that I've been undertaking with my team over the last couple of years, you may have already heard a little bit about. That is the State of the Nation Blood Cancer in Australia report, which we released last year. And in that report, we found for the first time the true scale of blood cancer in this country. Not just myeloma, but leukemias, lymphomas, all the other blood cancers and the associated blood disorders. And we presented that into the State of the Nation report. From that report, we've been able to, with support from the Commonwealth Government, to produce Australia's first blood cancer strategic national action plan. We have assembled the leading experts in the country under the Blood Cancer Task Force, and over the last 6 months, we've worked to produce the National Action Plan. Here we are in May 2020 with advice from people like Professor John Seymour, the head of haematology at Peter MacCallum, Delane Smith, who's the CEO of the Australian Leukemia and Lymphoma Group, the clinical trials group for haematology, Professor Mahir Gandhi from the Mater Institute in Queensland, who's a specialist in diagnostics and devices in blood cancers, to Professor David Joske from Solaris Health in Western Australia, who's also a leading treating physician and an expert in the emotional and psychological aspects of having a blood cancer. This grouping of over 30 of the leading experts in blood cancer have worked with the foundation to produce the National Action Plan. We're in the final stages of refining that at the moment. The task force has met many times over the last few months. We've had over 90 other experts across the country help us in our 7 working groups to produce the final document. That is, it's now in its current state, it's in a draft. We are finalising to make sure we've dotted our I's and crossed our T's, and we'll be presenting that to the Minister for Health, Greg Hunt, by the end of June of this year. So this is a tremendous achievement, not only for the Leukemia Foundation, but for the whole blood cancer community, because we've, for the first time, have support from the Commonwealth, as well as all these leading experts, to present a roadmap for reform, a roadmap that will change the way healthcare for blood cancer patients is considered and delivered. And that ranges from recommendations at diagnosis stage right through to supportive care, access to information, how you are treated at a hospital or at home, and the kind of additional support you may need as you become well and live better with your cancer. There'll be further updates from the Leukemia Foundation in the coming months as the report is finalised and the plan is delivered to the Minister, and we hope to have further announcements to you during Blood Cancer Awareness Month in September. So I hope you find Myeloma Day to be a useful day to understand more about advances in myeloma care and the advances we're doing now for the National Action Plan. Thank you.